This podcast is brought to you by Caoimhe Hartley. Whether you're feeling the effects of menopause or your menstrual cycle, discover what's key for you in less than 5 minutes. With tailored supplement recommendations, information and insights on caoimhehartley.com.
Hi, I'm Renée.
And I'm Donna. Welcome to the Caoimhe Hartley podcast.
In this series, we aim to educate and open up honest conversations with both medical professionals and real-life women.
We want to shine a light on those topics that sometimes go unspoken about and help empower women to know what is key for their health and well-being. Thank you for joining us for this episode of the Caoimhe Hartley podcast. Today we talk with women's health expert, Doctor Caoimhe Hartley. Caoimhe is the founder of Menopause Health in Dublin. Her goal is to help women access the best advice and individualised care for all stages of their lives.
You're very welcome to the podcast, Caoimhe. Thanks for coming.
Thank you for having me.
So Caoimhe is going to be our residence doctor on the Caoimhe Hartley podcast, and she will join us to answer medical questions around women's health.
So Caoimhe, tell us about your background, your menopause health clinic, and why you decided to focus on women's health.
Okay, yeah. So my background is in general practice. I'm a GP and I did my training in the southeast of Ireland, and I qualified many years ago at this point. And then I emigrated to Canada, just me and my other half, and had the opportunity to work in a fabulous women's clinic while I was there. Oh. So I worked with other very kind of forward-minded women who were really inspirational. The clinic was amazing, and we were really encouraged to subspecialize and find an area that we were really interested in. And so for me, that was really hormonal health. I did a lot of fertility, and that somehow led me to doing a lot of perimenopause and menopause work. And so I did some accreditation and exams while I was there. And then we moved home just before the pandemic in 2019, dragging the little Canadian kids and the Canadian dog with us. And after
Did they have accents?
They had a twang when they came home. Yeah. The youngest guy was 10 weeks.
Oh wow.
So he had no accent. But, and the dog may have had an accent, but I don't know. And then set up my own clinic about a year and a half ago, and we're based in Dalkey in Dublin.
Fantastic. That's some journey.
It is indeed, yeah.
It's been a busy couple of years.
Talk about
say that again, yeah.
Good timing though, because menopause and perimenopause has really blown up in the news and media, and everyone's talking about it. And so it's probably a great thing now that that's what you're focusing on, right?
Yeah, completely. So we're a menopause clinic, although we do a lot of other women's health as well. We're kind of broadening what we do a little into more generalised women's health too. But it's mostly midlife women's health. But it's really taken off, yeah. And it's funny, when I did my training in 2015, 2016 in Canada, it was still kind of at the fringe of a lot of women's health. And it's only really in the last 2 years, I think, that it's got into the zeitgeist. People are talking about it. Prescribing habits are changing. We're seeing more hormone therapy being prescribed, which has led to shortages. It's a whole conversation for a different day. Yeah. But yeah, it has really taken off.
And is that just in Ireland and the UK? Obviously, we all know Davina McCall has done a huge kind of awareness campaign in the UK. There's so much talk here on Joe Duffy and the likes. Do you think it's across the globe, or is it just around where we are?
I think it's global.
Really?
And certainly in the Western world, I think between the States, Canada, most of Europe and here.
Well, that's great.
Things have changed, yeah. And there's loads of reasons for that, but I think there's momentum building. And I think, women talk to other women, and that,
you think that's what it
contributes to them. Well, I think
we have to thank Joe Duffy though in Lifeline.
I did open my clinic pre-Joe Duffy, just to point that out, right?
You're the hipster of menopause.
That's
you're
there
the
OG. I'm the original, exactly. Well, not quite, but I think it has taken off for lots of different reasons. But it's great to see. There's a whole generation of women who got left out.
Yeah.
Yes.
I think people like my mother and her generation who didn't have access to really good menopausal care.
They just didn't talk about it.
Not at
They
all.
were afraid. Like,
True, but I think if you go back and look at kind of how they would have been educated on even periods and their menstrual cycle and reproduction and what happens when you have a baby and all of that, you know, had to be modernized and is much better now, I hope.
Yes.
But I think menopause is probably the last thing to, it's the bit of education we're missing, I think.
Yes.
Yeah, because it's just not, like, I think lately in schools they've sort of introduced more education around the menstrual cycle, which is fantastic. They could do more, but, you know, we're getting places, but there's no talk of it in school. So even from that young age, even girls just aren't aware. And then as teenagers, probably a lot of their moms are going through it and they don't understand, you know, and probably looking back now, I kind of can see mom probably was going through perimenopause and she probably didn't even understand what the moods and the irritability and the hot flushes and all, you know. You look back and you go, God, she never talked about it. No. Ren's mom went around with the tissue on her forehead for about 10 years.
Just go on, stick it on, like, and she'd be there peeling the spuds and she'd be there going, you go through this, and I'd be like, Mom, what's the story with that? And she goes, sure, it's fine. And the bead of sweat would be just rolling down her face, like,
and you couldn't see the other symptoms probably that she was also going through.
There was a bit of,
you know,
the odd time, and we were like, run.
It seems to be now women don't want to talk about anything else if they're going through that phase. Now they want to know more, which is great.
Oh, they're hungry for information. But it's so, I mean, it's cliche, but it's so empowering to have the right information, because then you're making informed choices. And I'd see my role in our clinic is not to tell people you all should be on HRT or nobody should be in hormone therapy. It should be, these are the options.
Yes.
It depends on what's bothering you. What are your symptoms? What are your values? What are your goals? And then let them decide. But you can't do that if you don't educate women properly.
Exactly. And everyone's symptoms are different. So like it's...
There's a way of looking at that I've heard from a few different sources, that menopause is like puberty in reverse. I'd love to hear your thoughts on that.
I think it has similarities to puberty in absolutely, that it is kind of an unwinding of hormones that we gain in puberty, but in other ways it's very different, because with puberty you're gaining something.
Yes.
And I'm sort of hesitant to say that with menopause you're losing something, because you're not. That sounds really negative.
It's just
but
changing.
It's the environment is different. It's not exactly the same.
Yes.
Same but different.
Exactly. I think it's oversimplifying in a way to say it's, you know, but puberty is interesting as well, and there are definitely similarities. Both are basically just turbulent hormonal times. And it's like the first trimester of pregnancy, same idea.
Yeah.
Any time in our life when we have a hormonal environment that isn't stable, so you're going through these kind of fluctuating hormones, whether that's puberty or the first trimester of pregnancy or immediately postnatal or with menopause, you're going to be symptomatic because your body doesn't like being strapped into this roller coaster that's all over the place. Yeah. And it happens with both ends of the reproductive spectrum, with puberty and with menopause. So that's what it really has in common with it, I think.
And so it's probably a good place to start is where it all begins is when the onset of menstruation and when the first period starts. So I suppose we're going to try and cover from the very beginning of the basics.
Okay, whistle stop tour of reproduction.
Go.
And go.
You know, what does a healthy period look like? When does it generally start? What can, you know, young girls look out for, that sort of thing, you know?
So you really start kind of, if you really want to go back to the beginning, you start as an embryo. Like when you're in utero before you're born, you have all of your, you know, primordial follicles, these little follicles that are going to ultimately grow into follicles that you ovulate from. You've all your eggs.
It's
basically.
Amazing. I think that's amazing when a baby girl is
you're
born.
Whereas men sort of do the job on the run and they're making sperm as they go. But we are born with all of our stuff.
Basically.
We're born ready to go. I mean, are you surprised? That's women all over. Like, you know, we're prepared. But they lie dormant until changes happen in your brain, and that's due to aging, and you get to puberty, and average age is probably about 11 or 12 to start having periods, but that age is decreasing across the world and nobody really knows why.
I find that fascinating.
Is it down to better nutrition?
Possibly,
or other factors? Or
evolutionary factors, nutrition, genetics, other environmental factors that we maybe haven't pinned down. I don't know is the answer, but it is dropping. Now, it's only a small amount. It's not dramatic, but it is falling. I think they've seen it more in the States than anywhere else.
And there's a lot of studies been done around that the last few years, hasn't there?
Yeah, absolutely. Yeah, I think
It's
they did
probably
they did a study in the States in particular, I think, to look at what's called menarche, which is, so you've menarche and menopause. So menarche is your first period and menopause is your last period, and everything else in between is everything else in between.
Yeah, the roller coaster.
Strap yourself in.
And so puberty isn't just your first period. Like puberty happens before you have your first period. So we see changes in breast development, we see changes in hair growth. You get hair growth in under your arms, you get hair growth in your pubic area. Your glands develop so that you start to sweat. You know, you might develop, and your skin changes, you get more sebum production, you might get acne, something I had as a teenager, which is no fun whatsoever.
Same.
Oh yeah, rough. Yeah, especially as a girl, I think, but probably as a boy as well, but especially as a girl. And so all those changes actually happen, and then your brain starts to change. And one of the classic things with, I always think of, the Harry Enfield Kevin sketch, and this like really this grumpy teenager who's just growling at you. Yeah, exactly. Yeah. So a lot of that happens, and the kind of poor decisions in inverted commas that we think teenagers sometimes make. It's because their brain is developing at different rates. So the part of their brain that has impulse control develops a bit later than the part of the brain that has logic and reasoning. Yeah. So they might think that's probably a bad idea, I shouldn't do that. But the part that controls that impulse to do it isn't there yet, hasn't matured. And so I think it's really interesting. Like your brain is so kind of it's flexible, it adapts, and it's this plasticity in your brain. It keeps changing under hugely hormonal influences. So through puberty, you see, if you were to kind of do a PET scan or an MRI or whatever and look at teenagers' brains, you'd see them evolving and changing in shape and how they function. And it's fascinating.
It is fascinating. Yeah. Don't tell the kids that, because they'll give you an excuse
that
or why they're acting the maggot.
Just my brain, not my fault. Yeah.
I forgot to do my chores again. Really?
So all of those changes start to happen. And actually the end of puberty is really marked by your first period.
Okay.
That's kind of the last stage.
Wow, okay.
Yeah. And then you have a few years usually where your periods are not regular.
Yeah.
And the
mine
reason
weren't
is,
for the start. I was
that's
I was
totally
expecting
normal.
another one 28 days later, and it was 6 months later I was there. Oh, this is great. I don't have to deal with this.
Because it can take 2 years, right, for them to regulate.
To kind of regulate.
Absolutely, yeah. And the reason is ovulation. So ovulation isn't kicking in a regular pattern for about 2 years on average.
I think that is a question that we have actually been sent by some younger girls, and they just don't know that. It's just an interesting one that it just doesn't become regular straight away.
Yeah, and again, if you're looking at parallels between puberty and then the perimenopausal period, same idea. So we see irregular ovulation happening. So it's not once a month in the first couple of years. And in perimenopause, irregular ovulation as well.
Wow.
And so your periods become irregular before they stop, would be the typical thing. Now, obviously, there's outliers to this, and there's exceptions to this, but that would be typical. So I suppose that kind of brings us to, well, what causes ovulation? Like, what is it? What's happening in a normal menstrual cycle?
Yeah.
If you're looking at the ovarian cycle and what happens with your periods and why we have periods. So basically, if we split it into sort of just an average, on average, we'll have a 28-day cycle. So normal menstrual cycle is about 28 days to 30 days long. And if you split that into two halves is the easiest way of looking at it. So you've got your first half, which is called your follicular phase, and then the second half, which is the luteal phase. So first half starts with a period. So the day you get your period, that is your day one of your cycle. And what your ovary then starts doing, it's getting ready to have another cycle. So it decides it's going, well, not it decides, that makes it sound like there's someone sitting in your ovary with a clipboard, like,
Time now, lads.
Yeah, ringing a bell. Yeah. But what happens is it starts to recruit follicles. So if you go back to what we said at the beginning, as an embryo, and you have all these primordial little, very immature, tiny little follicles in your ovary. So imagine them as a kind of stand in a sports stadium, just full of, players waiting to be called on. And exactly, yeah. And you have someone standing on the pitch, and so you take your little group out of that stand. So you recruit however many follicles. And then over the next 2 weeks, they get more and more mature, they grow, they get bigger until one becomes dominant. So that's your really big,
So
bigger
funny, I
mama
have a
follicle.
visual
I know,
of
same.
them all
yeah.
kind of working out and living their best lives. And they're like, hopefully they're like, I might be chosen.
The chosen one.
So then think of the one who's like the Hulk in
Yeah.
the corner. Okay, so that's your dominant follicle. And she basically elbows everybody else out of the way. And she does that because these follicles produce a hormone called estrogen. So that's where we get our estrogen from, is from these follicles in our ovary as they're growing. And so over that 2 weeks, you're actually making more and more and more estrogen because they're getting bigger and bigger and bigger. But there is a tipping point where that really big follicle produces so much estrogen that there's negative feedback. And that estrogen that big follicle is producing is switching off the hormone that's driving the growth of these follicles. So the big follicle is basically cutting off the hormone that's making all of the other follicles grow.
Okay.
And so it gets to be dominant.
Okay.
I can't think of a good analogy for that, but I'm sure you can come up with something.
Great.
And so usually at the kind of day 14 mark or thereabouts, obviously it varies from cycle to cycle and woman to woman. That follicle becomes so big that it sort of pops. You could insert a little popping sound here. Yeah. And out pops an oocyte, which is your egg.
Okay.
Okay, so that then travels down your fallopian tube in the hope that it's going to meet some sperm, be fertilized, and then you'll have a zygote and a growing embryo ultimately that implants into the lining of the womb. Okay, so first 2 weeks, loads of estrogen, growing follicles. One of the things, and one of the purposes of that estrogen in the first 2 weeks is to thicken the lining of your womb. So you've just had a period from day one, and then over the next 2 weeks, you start to build that lining up again. And that's because of estrogen.
Yeah.
Okay, when you get to day 14 and you ovulate, you start making a second hormone, progesterone. And progesterone's job is to turn that lining into something that is hospitable to an embryo. So it's a bit like, you're putting out all the bricks and you've all the cement. That's what happens in the first 2 weeks. Progesterone's job is to sort of make something uniform and functional out of that.
Okay.
And if you're pregnant, then that embryo gets to implant into this really suitable lining. But if you're not, you make this progesterone for about 2 weeks and then you stop making it and the lining comes away and you have a period and the whole process starts all over again.
Yeah.
So it's that lining shedding down, and that's what gives you your period.
It's
That's
like
exactly
a
what
comfy
it is.
duvet that's waiting for a possible pregnancy. And it's
Oh,
like,
we're coming
I
out with
will
all the
align
analogies
to-
here now. I was thinking Beyonce egg, all this sort of
Thinking of
thing.
a red duvet. Come in. I'll align to.
We're just confusing the matter now.
So many mental images. Yeah.
Cozy.
But that's basically it. But to get that kind of pattern of, 2 weeks of estrogen and then 2 weeks of some estrogen and lots of progesterone that then lead to a period at the end of 4 weeks, to get that pattern going, you need to be ovulating regularly, which is why we see not regular periods for the first couple of years and not regular periods in perimenopause, because it's anovulatory. You're not ovulating regularly. Okay, and it is more complicated than that, just to really kind of mess with your heads, because so that's what your ovary and your ovaries and your womb are doing, but your brain is like the forewoman to all of this, and is sitting up there with a megaphone and a clipboard and everything. So your pituitary gland, part of your brain, it produces a hormone called FSH. And another hormone called luteinizing hormone, LH. And it's the puppet master. And FSH is what's telling your ovaries it's literally follicle stimulating hormone. So it's telling your ovaries, make follicles, make more follicles, keep making follicles until that big dominant follicle produces so much estrogen, it stops producing FSH.
Yes.
And it sort of sits back. And LH, this other hormone it produces, that's to do with ovulation. It's part of how we ovulate. So it's not really something that we need to cover today.
Yeah.
But if you think of perimenopause and menopause, one of the blood test markers of menopause is a high FSH level.
Okay.
And it's because your ovaries are so
Yeah.
they're not producing follicles really.
It's like send out more FSH.
Exactly.
Come on, get them going. But
it's like, the forewoman has this megaphone and is having to scream at your ovaries to make them produce more FSH, to produce more follicles, to keep your reproduction going.
I think there's a lot of confusion there with women because they think they can just go and get this simple blood test and say, right, I'm officially in, perimenopause or menopause. But that fluctuates so much. You can't always rely on it. Or how does that work exactly?
True.
Because there's a lot of confusion out there about
it'll
when to
work
go.
with menopause.
Yeah.
but not with perimenopause. So when your periods are done.
And it's too late at that stage for a lot of people because they want to know what's happening now in perimenopause.
Yeah. And also at that point, if you come in and say it's been a year since I've had a period and I'm now 50, I don't need a blood test to tell me that you're menopausal. You are menopausal. The FSH is useful for two things. One, in fertility, and the second is in younger women whose periods have stopped, and we want to know why.
Okay.
Is it because you've reached menopause at an early age and your brain is having to produce this hormone because your ovaries aren't functioning anymore and it's having to scream at them, and that's menopause? Or have you stopped ovulating or stopped having periods for some other reason? And there are other reasons. But in a woman over the age of 45, if you stop having periods, the assumption is it's menopause. Yeah.
Do we ovulate every single month?
No, not always. No. So you'll have months where the balance isn't right, or you have a follicle that becomes dominant but isn't really functional, and so you don't ovulate. Other things can get in the way. Ovulation is quite sensitive to other factors, and they've shown times of stress, bereavement, so both physical and emotional stress. If you have rapid weight loss, if you're really athletic, if you do kind of really high level intensity training, or if you've gone through really psychological trauma, or you're under great stress, or whatever it might be, you can get what's called hypothalamic amenorrhea, which is a big fancy name that just means your brain has stopped stimulating your ovaries to produce an egg because it is interpreting this stress as not a good time to get pregnant.
Yeah,
and so this
it's very sensitive, isn't it? Yeah.
There's a lot more going on than we actually realise.
Absolutely, yeah. And then if you throw contraception into the mix, and obviously there's other things, that can happen, that like polycystic ovarian syndrome and there's other kind of medical reasons why someone might not be having a period or might not be ovulating every single month.
And just to touch on contraceptive, if you're on the pill, the period that you get on the pill, I've heard it's a fake period. What are your thoughts on that?
It depends what you mean by the word period in a way. Yeah, it's still a period.
Bleed,
it's just, and what do we even mean by, period isn't even the medical term. So, but yeah, I know what you're saying. It is a withdrawal bleed. Exactly. Yeah. So you haven't ovulated, but we've artificially given you estrogen and progesterone for 3 weeks usually. Then we've taken them away because you know the way you take a pill-free week, and there's a whole interesting history behind that pill-free week as well. For another day, perhaps.
Another episode.
And then because of that withdrawal, your lining is like, all those hormones that were supporting me are gone, and then you have a bleed because of that.
Because it has to shed at some point. So if you don't ovulate 1 month and you do the next, you still should, even if you don't ovulate in the month, you should still shed, right?
You can do, yeah. We'd see sometimes in perimenopause and again in puberty, if you go through a month where you don't ovulate, you won't necessarily have a period, but you can get some bleeding in those first few years just because the lining is kind of sensitive and it's not learning, but it's just developing, I guess. And it's developing under the influence of these new hormones. So you can get a bit of irregular bleeding for that reason. Things to watch out for, which I think are handy to know, reasons to be kind of concerned, or I should go and talk to someone. So very, very heavy periods, which are a really difficult thing to define. I mean, what's a heavy period? What I call heavy, maybe you don't, the medical definition, if you want to know, which I think is hilarious, is more than 80 mils of blood loss. So,
and so how do you actually measure that?
Well, I've never had a woman come in and say, well, I've measured it and I'm losing 110 mils of blood. Because how and why would you eat? Please don't do that.
I did hear the menstrual cups are a great way of actually seeing how much you're losing a day, but then again,
maybe someone should make a menstrual cup that actually has little gauge
like
on
a
the
tiny
inside,
little measuring cup.
Measuring cup, and it's like, we're up to 15 today.
Who has the time though? God,
true, and it's kind of icky in a way to be thinking about trying, because I think what I mean by heavy bleeding is bleeding that's affecting your life. If you can't function or you can't do normal daily things or whatever you think should be normal daily things, and if you're getting up at night, that's a key as well. If you're having to get up at night and change a pad, that's a bit of a red flag for me,
especially if it's a night pad as well.
Absolutely, that's not normal. And if your history has been of having normal, in inverted commas, my periods were one way for years, but now there's a dramatic change, that's a red flag too. But for younger girls who are just starting off, if the bleeding is so heavy they can't go to school or they can't do sports, or they that it's not manageable, but then it needs attention,
And so if there was a mom listening or a girl who was or a woman experiencing heavy bleeding, what should she do?
I think the first protocol is to check in with your GP.
Yeah.
And start there. And
start the conversation.
Absolutely. Go through a history, go through some basics, figure out are there investigations that need to be done. What we're looking for with younger women is often things like polycystic ovarian syndrome or endometriosis, which won't happen at puberty, but develops over adolescence.
It's possibly...
and it's usually, the hallmark is usually pain with endometriosis. So endometriosis is where you would find tissue that should be your lining, should be inside the womb, outside of the womb, and nobody really knows why. We don't know, is it an autoimmune thing? Is it genetic? Is it environmental? We're not sure.
How does it get there?
I don't know.
I
don't know.
So it's really a grey area at the moment, and it's quite a lot of women that are suffering from it, and
10 to 15% of women I think have polycystic ovarian syndrome, and similar probably have endometriosis, if not slightly more.
And are a lot of them linked with some people, or they even have one or the other, or
they're not linked to each other necessarily. Okay. They're two separate conditions. So endometriosis, where you find these little pockets of tissue outside your womb, is a spectrum. So we'll have women who have no symptoms at all, but then might find it hard to get pregnant in their 30s or whatever. Later. Exactly, yeah. And it's a kind of retrospective diagnosis of like, oh, actually, this is something you've probably had for years, but you weren't really suffering with it. And in fact, the majority of women with endometriosis don't have a fertility issue. And so if you don't have symptoms from it and you don't have trouble getting pregnant, there's no benefit to knowing that it's there in a way.
Yeah.
So it's something
causing big problems.
Exactly, yeah. But I'll often speak to women who say, I had horrendous periods in my late teens, my 20s. I didn't have a problem getting pregnant, but like I couldn't go to school. I had issues with work.
The same with Donna. Donna used to pass out at school.
Like,
I think I had endometriosis. Like I definitely do. I don't like, I suppose back then I just never talked about it, but I was like not able to do anything for 4 days out of every month since I was 14.
Yeah. The trouble is, so you're very possibly correct, and that's maybe, and that is maybe what's happened.
But my question is, like, I don't have an issue with it anymore.
So it's hard to know after pregnancy, like things, because the environment changes.
And I look after myself differently now as well than I did when I was younger. I'm more aware of my menstrual health and nutrition and things like that. But I don't know, does it go away or does it get worse?
It can recede, and different things. Like pregnancy is actually really helpful for endometriosis because you're not having to have a period every month, which really helps. And it changes the hormonal environment for that period of time. And so it's not something that you have to continue to have symptoms with. It can change. And why women get mild symptoms and other women get really severe, we don't know either. But it's graded, it's grade 1, grade 2, grade 3 and so on. Depending on where those little pockets of tissue decide to deposit themselves. And if they're on your bowel, you might get women with really bad bowel symptoms. Rectal pain is a symptom of endometriosis. So women who say, once a month I get really bad pain in my bum, I get really bad rectal pain, I don't know why, I get really bad diarrhea with my period, which can be common anyway, but it can be a symptom of endometriosis.
And then when it comes to polycystic ovarian syndrome, PCOS, that's a minefield as well, because you don't actually have to have cysts on your ovaries, do you, to be categorized?
It's poorly named. As it turns out. It's a bit misleading. So that's
about the insulin resistance and about that as well. Like, it's interesting.
PCOS is really, again, really interesting. It's probably genetic, or at least that's the thinking. It's really common. And again, like endometriosis, it's a spectrum. We have women who have no symptoms and women who have severe symptoms and everything in between. And it's a bit harder to pin down what is actually happening with polycystic ovarian syndrome, but it seems to be to do with, it starts with insulin resistance. That seems to be the original issue. And because of that insulin resistance, you start making more insulin. So insulin produced by your pancreas, its job is to move glucose, which is sugar, out of your bloodstream and into your blood cells so that it can be used for energy. And if you can't do that, if your cells are like not sensitive to the insulin you have, hence insulin resistance, you have to make more of it.
Yeah.
So you make more and more insulin, which is fine. Your blood sugar is usually normal for polycystic ovarian syndrome. It's not the same as diabetes.
Okay.
They've normal blood sugar because with the extra insulin, it works.
Okay.
And they maintain their blood sugar in a normal range. But that extra insulin, if you bathe an ovary in an environment with lots of insulin, your ovary produces more androgens, which are kind of a testosterone-like hormone. And the knock-on effect of that is you can stop ovulating and you can have symptoms. So classically, it would be acne, excess hair growth, which is also a difficult thing to pin down.
Places.
Well, every woman I ever talk to, if I ask them, do you think you've excess hair growth? They all say yes, because we're told you shouldn't have hair anywhere. You should have hair in your head, maybe hair in your eyebrows, no hair anywhere else. Anywhere, ever. Do you know what I mean? So like, because that's everywhere.
Like, I want to be lasered from the eyelashes
just
down.
from my neck
Laser
down.
clinics are out the door.
Yeah,
It's
yeah,
ridiculous.
And I think that's awful, because I think women think if I grow hair anywhere, I've excess hair growth. Like, it's just, normal. It's normal. So by excess hair growth, what we mean is hair growth in a male pattern. Okay. So hair typically, although we all have hair on our face, but it's excess hair on your face that you might have to shave or deal with.
Yeah.
Or hair on your chest. It's unusual enough for women to grow hair on their chest, and so on. So it's in a kind of male pattern.
Yeah.
You can see thinning on your hair. Again, if you think of kind of male pattern hair growth on your head. Acne, I think I've mentioned, weight gain can be common, but not everybody with polycystic ovarian syndrome has a larger body mass index. Again, it's a spectrum. Fertility can be an issue because you might not ovulate once a month. I think, have I covered everything? I think that's everything with PCOS. Yeah.
That's brilliant.
This podcast is brought to you by our very own brand, Key for Her. Whether you're feeling the effects of menopause or your menstrual cycle, discover what's key for you in less than 5 minutes with tailored supplement recommendations, information and insights on keyforher.com.
Please have 20% off on us by using the promo code KEYPODCAST in all capitals.
I think when it comes to diet and lifestyle, especially through, well, I was going to say through puberty, but actually through your whole reproductive life, it is a balance. Yeah. I wouldn't be kind of recommending a particular diet or a particular lifestyle change. Obvious things like smoking, we all kind of know is bad for us, and definitely seems to have an anti-estrogen effect. So women who smoke have earlier menopause, for example. And then there's all the other outcomes with smoking, like your cardiovascular health and your lung respiratory health and so on. And the same with alcohol, everything in moderation. And then in terms of diet, I think it is just a healthy diet. Like crash dieting and calorie restricting is going to have an impact on your menstrual cycle. Your brain will interpret that as, we don't have enough food available, terrible time to grow a baby.
Yeah. So like the stress, ovulating. It's just like,
Same thing.
oh no, you're just not getting enough food. You can't carry a baby. So it's kind of recognizing.
Yeah. It's protecting you, because it's like, well, we need these calories for our body, and growing a pregnancy would be a bad idea. So that's why, not to mention, I suppose, if that happens and you stop ovulating because of that, and you're not producing a huge amount of your own estrogen, there's knock-on effects for things like your own bone density and, and
which again, in menopause, it'll...
Same idea.
Yeah.
Yeah. So important to just have a well-balanced diet, have adequate calcium, have adequate protein. It's all about balance. Yeah.
Can I just ask you about research into women's health? And, I've heard a lot that we weren't included in a lot of clinical studies for a very long time, and only recently in the last kind of 10, 15 years. Is that right? Or is it longer?
Yeah, no, I think you're right. I think it is only the last probably decade and a half.
Really.
Yeah, well,
I mean, you can kind of see it.
Who is doing the research? Like, is it shocking? There's a famous study in the States called the Baltimore longitudinal study of aging or something. Anyway, the point was they got a load of people, and their plan was, we'll look at aging in a really big population so that we can learn more about aging. We'll look at all these different factors, and so they were like, okay, aging in the human race, and so they enrolled thousands of men, and they enrolled no women. What? And it took 35 or something years until they decided we should probably include some women. And the thinking was, sure, women are just another version of men. Yeah, that
was the old thinking. Like,
you could extrapolate from.
That's insane.
I know, but again, is it surprising? Like, it isn't. And I think one of the principal investigators was challenged on it and asked, why are there no women in your study? And he said, well, like, they're really difficult to study because, they have this like...
Too much hassle.
and their hormones change from month to month, and they go up and down. God. And it's not a level playing field, whereas at least men, like, their hormonal environment is a bit more stable.
You think they'd be more interested in that than going with the easy option?
We are too difficult to study, and so they left us out. But that's true. There's loads of there was another one looking at coronary disease, like cardiovascular disease, heart disease, and it was to do with hormone therapy and estrogen, and they gave men estrogen and looked at their heart health. I swear to God.
Give it to women.
Yeah.
So do you think then maybe that's part of the reason why all of this talk about, women's health and all these things are coming up and in focus now because more research has been done?
I think more research probably is being done. I think one of the issues I face is that a lot of the time we're talking about things and having to caveat it with, like, I'm really sorry we don't have really good data on that, because that research should have been done 30 years ago, so that I can now say, well, with 30 years of follow-up, we know X, Y, and Z, and we don't have it, which is really frustrating. Testosterone is a really good example of that. So going back to what we were saying about your ovaries, they produce estrogen, they produce progesterone, but there's a third hormone, testosterone, that you then convert into estrogen. And you can,
a lot of women don't know that. They just think testosterone is a man's hormone.
But we make more testosterone than we do estrogen. So
wow.
Yeah, like all three of us have about 3 times as much testosterone as we do estrogen, but about 1/10 what men have.
Okay.
So it is a more masculine hormone, but it's our dominant hormone is testosterone. And it falls in this really gradual way. So you start producing it in puberty, and then it sort of peaks in your mid-30s, and then it falls really gradually. And a study in Australia recently showed that it starts to go up in your early 70s, and nobody seems to know why.
No wonder they're all allotted in the They're having a great time.
Get out of that room.
Keep your hands to yourself there, Mary.
The poor nurses, no wonder they're probably driven cracked.
Swatting them away from each other, but it doesn't kind of fall off a cliff the way that our other hormones do with menopause, and that's why I guess we don't pay it quite as much attention, because we continue to produce it.
We always ask everyone, can you remember your first period? And we got
I
a
knew
little
you
story
were
about
gonna
it.
ask me
Sorry, everyone has a story. And was it like funny or good
Nothing
or bad
sacred
or
here.
positive? Yeah. So.
Oh God, you're both looking at me like, okay.
Yeah, come on, tell us. We've told our story,
okay,
so
fair
you
enough.
have to tell yours.
So I actually had a music class. I used to play piano that my mum would bring me to after school, and I got home and realised that I'd had my first period and wanted to crawl into a hole and never come out. Yeah. And also the dawning on me that, like, that stain has been on my uniform since I don't know what time today. You know, that horrible thing of like, how long has that been there? And my mum had to go, she'll kill me for telling the story. My mum had to go out and play bridge that night. So there was kind of okay, there you go. You know, here's the sanitary towel. Bye. And like, she was gone. And my dad, who'd be the most private, like never talked about stuff like this ever at all. My dad was obviously informed on her way out the door. And I remember my skin wanting to just leave my body, because he said to me, will we get a takeaway tonight? And I was like, I knew then he knew something had happened. Like,
Stop looking at me.
Exactly. I was being treated like an invalid then. I hated it. I was like, stop treating me like this.
Yeah.
But it's imagine like as a young girl being so mortified about it. And we had the girls any time of the month. Do you know them?
I do, yeah.
They're great. And we got them to talk about their first periods. And like, obviously, they're a lot younger than I am. And they still had that stigma around being absolutely mortified and hiding the pads and the tampons up the sleeve, and even in an all-girls school. So I hope that through all these conversations that we have, are involved in and have started, and everyone else that's getting involved, that it becomes less embarrassing for girls and that it's not something to be ashamed of.
Yeah, well, it's all of us. So, and like, I still think, it can be something that is private, and it's we all go to the bathroom, we all go to the toilet, we're not having to kind of talk about it all the time, but like, you shouldn't be scared of it, you shouldn't be embarrassed by it. I think having access to products is really important. And also, like, going back to what we said about painful periods and heavy periods, and knowing that you don't have to just put up with all of that. We have so many options and management options to help younger girls in particular with periods that are uncomfortable or difficult. And if they just don't want to have them, we can get around that too. You don't have to have a period every month. Like, from a health point of view, you don't have to have a period every month. And so we'll often ask women to run the pill back to back. Don't take that week off if you don't want to have a bleed.
Okay.
And
I
there's nothing
suppose
wrong with that.
especially with girls as well, if they were having a hard time of it, and say if they were going through exams or something, or they just wanted to make sure perhaps like that wasn't going to be a huge issue for them perhaps at that time.
And sports and athletics and going out to someone's house, staying over in someone's house, and like all these other things, you know, that you would have been planning around, or we would have probably done that. There's so many options now that are really helpful. So my almost 7-year-olds, like they're almost the other extreme. I'd say that they're almost too blasé about all this stuff, because I don't want them to grow up fearful, and I don't want them to kind of be terrified when they get a period. And I want them to, like, you know, I think even putting sanitary products in their school bag when they get to 10 or 11, having them prepared so there isn't this kind of,
that's a nice idea, actually, just have them a little
emergency
prepared.
Something, just so
emergency
they're not
stash.
scrambling, you know, or having to ask a teacher or a friend, or, you know, and having the conversation early, but not too early. So I haven't sat my girls down and said, now listen, this is your menstrual cycle, you know, and so on. And because I think that's just, there's no need, and it's too early, but not hiding it. So they waltz in and out of the bathroom, you know, and we'll say, like, they'll hand me a tampon if I ask them and they know what it is. And if they ask a question, I answer it.
And that's you normalising.
And if they don't, I leave
house,
it.
So it's great.
So I don't corner them and say, but they do occasionally come into the clinic and I have like a poster on the wall of, like, you know, reproductive stuff, and there's pictures of vaginas, and like, because it's helpful when I'm chatting to patients to point at stuff, but they can stand there and they can, like, they list
so
stuff.
informed.
That's
Brilliant. That's amazing.
Is it? It's a balance, I think. You know, it's a balance.
I get a chart for our house now for my little one.
They think that we have a gynae bed in the clinic for doing procedures and stuff. They think it's a dental bed, which I think is hilarious. So I don't know what they think I do.
And they hop up.
But that's when they'll hop up if I'm sort of doing some notes and paperwork, and they'll hop up in the bed.
Now, that doesn't look like the
wait
mouth.
a second. And they'll play dentist on the bed. I'm like, wrong end.
Oh, that's funny.
So what are your 3 key tips for good hormonal and menstrual health?
Okay, I think tip number 1 is educate yourself. So know what is, I hesitate to say normal, because there is no normal in a way. We're all totally different. It's the same with menopause and perimenopause. It is a spectrum, but know what, know that if you are having issues, if you're having heavy or painful periods, if you're having irregular periods and you're concerned, it is worth a conversation. Don't stick your head in the sand and don't feel like you have to put up with it. Number 2 would be look after yourself. I mean, obvious things. And I think a balanced diet, getting enough sleep and not over exercising, and just, I mean, it's all very cliche probably, but like, to just mind yourself is really important.
But it's the basic stuff we don't do, you know.
Self-care.
We have to be reminded.
Absolutely, yeah. And I think, let me see, number 3 in terms of a tip for menstrual health.
I suppose, though, another thing, one thing, I don't know, do you tell any women or girls that might come in, is to track their cycle so they know what's normal for them if they do need to go see a doctor, as to, you know,
I think
so they can kind of see
personally, I think you can over track sometimes, and it can cause almost more stress occasionally. I think it is useful to keep an eye on it. All I'm saying is I wouldn't be kind of saying, look, God, it was 2 days late. So we would, again, going back to kind of a medical definition, we would define irregular periods as having a variability of more than 7 days per month. As in, I'm 7 days late or I'm 7 days early. Back to back.
That'd be a big kind of
that's kind of outside the normal range. It's normal to have periods that vary by a few days every month.
Because I was never bang on 28 ever.
No one is.
A few days either way, but that was normal for me.
Exactly. Yeah. So I just worried that sometimes the period trackers, that you can create almost too much. Okay. You could be too married to them. But by all means keep an eye, because it's handy. They're really helpful for fertility, and they're actually kind of helpful in perimenopause, because it's often helpful to look back and say, look, you know, you've come in saying, oh, these symptoms I have, are they hormonal? I don't know. And we can look and see, well, actually, look how irregular your periods have become over the last year. So they can be handy there and for fertility. But outside of that, I wouldn't get too bogged down in making sure you're absolutely clockwork, because you're probably not going to be. Yeah.
Thanks a million for coming in and talk to us today, Caoimhe. So where can our listeners find you if they want to book an appointment or find out more?
Yeah, they can go to our website, which is www.menopausehealth.ie.
Perfect. Thanks a million. And
you're very
can't
welcome.
wait to see you soon.
Absolutely.
Thank you.
Take care.
thank you so much for joining us on the Key for Her podcast. We'd be so grateful if you could hit subscribe, rate, and share this podcast with your friends.
For tips, tricks, and hacks on all things perimenopause, menopause, periods, menstrual cycles, and skin health, follow us at Key for Her on TikTok and Instagram.
Check out our website, keyforher.com, for more information.